Yes, 18th day in the month of January 2020, specifically on Saturday. And you know what our Saturday stands for? It stands for Health Matta, where they take deal with everything we get to do with hygiene, cleanliness, long life, staying fit and healthy. My name is never changed, now still Chief Olododo. Good morning once again, and still me, myself, Doctor.
Yeah, good morning, Slimmy.
Good morning,
Good
Doctor.
morning, Chief.
How you
Good
doing?
morning, sir.
So pleased to be with you.
Same
Pleased to
here.
be here
Good
too.
to have you.
Yeah, good morning, viewers at home and around the world. We welcome you this morning to Health Matter on WAP TV. Today we'll be looking at Lassa fever. It's a topic we started last week. Okay, we're going to look at definition of Lassa fever. We're going to look at symptoms, signs and symptoms of Lassa fever. We're going to look at diagnosis. We're going to look at prevention. We're going to look at treatment. Okay, but essentially too, we also do an X-ray of what efforts we, Nigeria as a country, has been able to make in the last couple of years concerning this disease of public health importance. Okay, now let me start by saying that it's about a year ago that the very first national international Lassa fever conference held in the world, and of course it was in Nigeria, in Abuja. It's about a year ago that it held, between 16th to 17th of January last year. Now, it was a gathering of about 700 individuals from about 15 countries of the world. It was a scientific conference on Lassa fever and partners. Now, the essence was to look at what we've been able to achieve over the years. The theme of the conference was Lassa fever. The theme of the conference was Lassa fever in Nigeria, and then the challenges arising, or something like that. Okay, so I'll recollect shortly. Now, essentially, it has been about 50 years since this scourge started. Don't forget, last week we mentioned that the discovery was in the year 1969, and we were able to show a short video clip of all the people that played prominent roles in the discovery of this disease, as well as the early people that actually survived, the first woman that survived the Lassa fever. Since then, it has been from one progress on to another. Okay, at the moment, a lot of advances are being made towards the development of a vaccine, okay? But we are not yet there at the moment. So this scientific conference that I held about a year ago looked at a number of all of these things, the efforts that have been made so far, where we are at the moment. At the beginning, we had only one major treatment center in Nigeria for Lassa fever, talking about Irua Specialist Teaching Hospital. But today we have about 3 of them. We have one in Dr. Alex Ekwueme Teaching Hospital in Abakaliki. Okay, we have the latest addition in Federal Medical Center, Owo. And in the last 1 year, they've been able to add another Lassa fever / acute viral hemorrhagic fever laboratory lab to the existing 3 that we had in Nigeria before. So currently we have 3 major treatment centers for Lassa fever in Nigeria, and we have 3 very good reference laboratory for Lassa fever and other viral hemorrhagic fever. So those are some of the achievements that have happened in the last 1 year. Also, in this conference that we talked about, there was a lot of brainstorming by stakeholders, by scientists that are involved in this disease. It was an opportunity of Nigerian partners to meet other foreign partners that came for the conference, vaccine developers, companies, WHO representatives, and what have you. Okay, so that is to say that Nigeria as a country has not folded her hands while this disease ravaged our country. It is a perennial problem that we have said before. It is endemic in Nigeria and another West African sub-region. Is endemic in Nigeria, is endemic in Sierra Leone, is endemic in Guinea, is endemic in Liberia as well. Now, the latest is Benin Republic. We've also seen some sporadic cases in some of the West African countries that are around us, talking about Ghana, as well as Mali and even Cote d'Ivoire in the last couple of years. Now, what is it all about? Lassa fever is an acute viral hemorrhagic disease or illness, okay, with an incubation period of 2 to 21 days, okay? It is a zoonosis, it's a zoonotic disease. What that means is that humans can pick this disease from animals, and usually in this case, rodents. And last week, we were able to mention that it is not all rodents that one can pick up this disease from, okay? Now, it is a species of rats, just like Slimity rightly pointed out, known as multi-mammoth rats, or yes. Now, multi-mammoth means, talks about the pair of breasts that are usually found in this rat, okay? That is what it's all about, multi-mammoth rats, okay? Now we can see a picture on our screen, okay, displaying the type of rats, yes, that causes this disease. So it's a zoonosis, it's a zoonotic disease, okay? Apart from the fact that humans can pick this infection from rats, it can also be passed from one individual to another. So there's a possibility of person-to-person transmission. Oftentimes we see a number of nosocomial infections in a hospital environment. In the last couple of years, we have heard about solid stories of healthcare workers that have lost their lives in trying to cure for the sick people in our community. One particular death actually struck me so hard. It was that of a house officer that started work 3 months into his duty. He came in contact with a little girl. He was on duty in a pediatric unit and came in one of the hospital, Federal Medical Center in the north. He came in contact with a child that presented with febrile condition. And of course, with little knowledge about this disease, okay, few days after, he actually was discovered that he has picked up the infection, and unfortunately, he did not survive. He was a 30-year-old doctor. May his soul rest in peace. Ditto for other healthcare givers.
That means, sorry, sir. That means he's been carrying it for days without knowing. Because
No,
he said the incubation period is between 2 to 21 days. I was thinking it would have lasted for 3 weeks.
No, I don't have an idea of what the duration actually stayed before he passed on. But it was discovered that the child he was treating also did not survive. Okay, so it was discovered that he was infected in the line of duty. Okay, so we are always in harm's way trying to care for one another.
But
Okay,
doctor, sir, does this mean that every health caregiver now should actually be attending to their patients in gloves just to stay safe? Does this?
it's not just gloves. There's what we refer to as personal protective equipment, PPE, and there's also what we refer to as universal precaution and barrier nursing. Number one is, as a healthcare giver, you must have a high index of suspicion. Okay, you must have a high index of suspicion when you're attending to someone with an acute febrile illness. Okay, you must be thinking about what other things can it be. By the time you're able to rule out the commonest we have in this environment that can cause febrile illness. Febrile illness means an illness that can present with fever, elevation of body's temperature. Okay, you could have that in malaria, you could have that in typhoid, you could have that in urinary tract infection. So once you're able to quickly rule out some of these commonest ones in our environment, you should also have at the back of your mind that it could also be a case of Lassa fever. Don't forget, it has been with us for 50 years, and I can tell you that all year round in Nigeria, we keep seeing cases and cases of Lassa fever outbreaks. 2018 was unprecedented. We had a lot of deaths coming from the confirmed cases of Lassa fever. Suffice to also point out that the number of people that were said to have been infected with this disease in 2019 were more than that of 2018. But the number of deaths in 2018 was more than that of 2019. Now, what has happened is, as a result of the efforts that are being made by Nigerian government, NCDC and other partners, as well as WHO and other partners in Nigeria and around the world, are talking about West African sub-region. So it could be traced that the progress that have been made so far, maybe as a result of, number one, early presentation in individuals who have this infection, increase awareness, as we are trying to do today, to raise the awareness of this disease, that for us to know that these infectious diseases are still very much with us in the country. Okay, it keeps coming every year. Usually it peaks at about this time of the year, talking about the dry season or the harmattan season. This is about the time it peaks. Usually at about this time, you have a number of bush burning happening in some places around us, and these rats are being chased from their normal habitat, okay, into the communities where humans live. Okay, so talking about signs and symptoms of this disease, let me start by saying that 80% of people that may be infected with Lassa fever may not actually come down with the disease. Yes, they could have mild symptoms that could last for a short period of time and then it disappears. They could have headache, they could have swollen glands, they could have fever, they could have sore throat, okay? They could have general weakness, muscular pains, malaise, and what have you. This could last for a short period of time, and of course it disappears. Now, 20% of individuals that may pick up this infection, talking about 1 in every 5 individuals that may pick up this infection, will actually come down with the disease. And when that happens, 15 to 25% of such people that may end up being hospitalized will come down with much stronger symptoms. In such people, you could have fever may reoccur, and it could be prolonged for a long period of time. Apart from fever, they could actually have hemorrhage, bleeding, usually from the gums, from the from the nose, orifices of the body, from the ear, from the nose, and some other places. That's actually where the name hemorrhagic came out from. Okay, so hemorrhage is just the same as saying bleeding. Okay, so in advanced cases too, people could come down with multi-organ failure. Okay, they could come down with liver failure, they could come down with kidney failure, and a number of other organs in the body. They could also have accumulation of fluid in the lungs, okay, pleural effusion. They could have pericarditis, accumulation of fluid around the heart. They could have encephalitis. And of course, if these people do not receive treatment on a good time, they would die. Many of them, 15 to 25% of them, may not survive in a period of 14 days. So these are some of the significant signs and symptoms that you and I need to look out for. But we must not wait until one begins to have these stronger symptoms that we are talking about. Once you're a healthcare giver, healthcare professional, and before you have a patient who is presenting with acute febrile illness, you've ruled out the common symptoms, the common illnesses we have in this environment, you could quickly do a rapid diagnostic test in the case of malaria to actually rule out malaria. Once you've been able to rule out and you put this person on treatment, 2 to 3 days after, if the person is not getting better, you should also be considering that it is a strong possibility this individual may have Lassa fever. Okay. Also, in the week 52 from Nigeria Center for Disease and Control, currently, I'll give us the figure we have shortly in week 52, so that some will actually get to know that these things are with us. Okay, so week 52, ranging from 22nd of December to 29th of December 2019, 93 cases of suspected Lassa fever cases were recorded. Among these 93 cases, confirmed cases were 16, and of course, 4 of the people that were affected did not survive, did not make it. Now, the 93 suspected cases of Lassa fever that was reported, okay, actually happened in 16 local governments, in 9 states, as well as Federal Capital Territory. Edo State came highest, had about 25 individuals that were suspected to have picked up this infection. Edo State wasn't highest. Edo was 25, Ondo 41, Ebonyi 15, Bauchi 5, Adamawa 1, Kogi 1, Enugu 2, Cross River 1, FCT 1, as well as Katsina State 1. And out of this, there were 16 confirmed cases, and 4 deaths were actually recorded. The deaths that were recorded were Ebonyi, 2 people died, Ondo, 1 person died, and Bauchi, 1 person was not very fortunate. Okay? Now, it is not to say that people can't survive this disease. People can actually survive, but the key to surviving the infection or the illness is early detection. Now, one of the things I would like to mention here is, now, the most significant complication that could come in people who may have suffered Lassa fever is deafness. Okay, it could be partial or permanent deafness. In people, in the individuals who have been affected, okay, they could come down with deafness. So that's one of the complications that could come with Lassa fever. Now,
Okay, Doctor,
transmission.
Sorry, before we go to the transmission, sir, I think we need to go on this short break. When we come back, Doctor will take us through
transmission.
Yeah, from transmission. Okay, we'll be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show where dey help people. Terms and conditions apply sha o.
We're up in our 90s now, like a lot of us in the lodge here. Everybody here in the SIM calls me Penny, but my family call me Lily, the real name. So I have to think when I'm writing to people, what do they call me? Hello, I'm Lily Pinio, better known as Penny is my nickname.
I am a physician. I got my degree in medicine and in public health. Right there, should I point to it? There I am. And then went to Nigeria for about 7 years. And here is the back of my head.
My father was a doctor. My mother had been a missionary in India. My father fell in love with her when she was on furlough. In their wedding ring, they had the scripture from the Psalms, God be merciful to us and bless us, and cause thy face to shine upon us, that thy way may be known upon earth as saving health among all nations. We had 4 kids, and because of our missionary background, the Lord led our sister to India with her family, our brother to Alaska, me to Nigeria, and Rose, my sister, specializing in cardiology, was taking care of our mother for years. Well, they didn't go get kids for all nations, but many nations. So I went to Jos, Nigeria, and worked in a mission hospital there for 38 years, wonderful years.
She was extremely ill. We had 23 cases that we identified later as most probably being Lassa fever. And of those, I think it was 12, if I remember correctly, that died.
I had high fever. It was very hot. I wasn't able to eat very much because of my sore throat. And otherwise, everything was dull.
The high fever, the extremely sore throat, massive swelling in the neck.
And I lost my hair. I was wearing a wig for about 2 years.
Probably one of the most difficult things was not knowing what we were dealing with. We didn't know how to treat it. We knew that it wasn't malaria. We knew these were high fevers. They were strange symptoms that we never saw quite that way. And wasn't really frightened, but mystified. We didn't know what it was.
The very next year at Evangel Hospital, there's another outbreak, 28 cases, and half of those were deaths, including Dr. Jeanette Traub, who was the medical superintendent.
I spent a lot of time with Dr. Traub. I was there immediately after she cut herself, and I was with her when she died. We didn't know we had Lassa. We considered it, but it was interesting because that was about the time that Time magazine and Newsweek had it in their pages, and all of a sudden here we had it again. After Penny was back with her antibodies.
After I had recovered, because I had antibodies, the doctors used me to get their blood specimens. My serum has been used to save other lives. Dr. Cassell was one of the 2 doctors at Yale University who discovered the new virus, and I gave my serum to him, and he recovered. It gave him 35 more years of life. Wonderful opportunity. So these were wonderful years. Thank you.
Yes, welcome back to Health Matter, and Dr. Bat won't take us through the journey of the transfusion now. We are ready, sir?
Yeah, transmission.
Transmission.
Okay, but before we go to transmission,
transfusion.
the international conference that I held in Nigeria, in Abuja, at about this time last year, the theme was 50 years of Lassa fever in Nigeria, rising to the challenge. And the question we want to answer this morning, I want to also ask all Nigerians, have we truly risen to the challenge? Okay. The answer, of course, is yes and no. Yes, some good efforts have been made. Okay. No, because we are not where we want to be at the moment. Okay,
Doctor, I'm sorry, can I just ask you a question? Because really,
Yeah.
I've been wondering why we have just 3 hospitals,
Three treatment centers.
three treatment centers in Nigeria. Is it that the equipment are quite expensive, like what they need to treat patients and all of that, victims of Lassa fever? Is it that they are really expensive that we cannot afford? Because I'm trying to imagine that, okay, imagine someone coming down with that in Lagos. So it means if the person does not get to Ondo, he might not get treated. Is that what we are saying?
Or are we paying a laid-back effort to it? That's
No,
the treatments are not.
no. What I want to say on all of that, yes, it is true that we have 3 major treatment centers in Nigeria, okay, that recognize Lassa fever treatment centers. We mentioned them a while ago. I'll mention them once more. We have the major one, about the oldest of them all, the Irwa Specialist Teaching Hospital, located in Edo State.
Is that the Alex Ekwame?
No. The Alex Ekwame Teaching Hospital is located in Abakaliki, in the southeast. And of course, the third one is Federal Medical Center, Owo. Okay. In the last 1 year, they've been able to establish a Lassa fever / viral hemorrhagic fever laboratory in Owo, meaning that samples from Lagos State can easily be sent to Owo for confirmatory tests to be done. Don't forget, we said that the diagnosis of this disease is not something that can be done in just any laboratory. So you must send them to reference laboratories. Coincidentally, too, those reference laboratories that we have around also are also centers for the treatment of Lassa fever. Okay, so what I understand is ongoing at the moment is that personnel are being embedded to follow up with the newly established one in Owo in order to actually put them through in some of the things, some of the challenges that could occur in the course of doing the diagnosis. Truly, we have 3 major treatment centers in Nigeria, which, of course, in my mind, I don't think it's enough for our teeming population. Okay, so government needs to do more than they're currently doing at the moment. One other thing that some of the achievements too, because I actually read an interview or a write-up by the Director General of NCDC. We have Princess from Lagos. Okay. Good morning, Princess.
Good morning, Princess.
Good morning.
How
Good morning, Doctor.
Yeah,
How
good morning.
I'm good. I want to ask about a fertility issue.
Okay.
Yes, for over 25 years, I've had issues of infertility. Hello?
I'm with you. We're with you.
Okay, I did, it was an abortion I did some years ago.
Okay.
And ever since then, I'm unable to conceive. I've done all kinds of tests. I've gone for HSG. I've done sono, like hydrotubation. But up to now, I cannot get pregnant.
Okay, thank you very much. First of all, let me point out that the topic for today is actually not female infertility. But that said, I will answer the question. Now, do you have an idea of the diagnosis? Do you have an idea of your diagnosis? Did they tell you what you have, going by the number of tests that You've
Yes, after the HSG, I was told there was a perifembral adhesion.
Good. Now, these are some of the things that can happen. Obviously, it could be a fallout. It could be a complication that arose as a result of the D&C that you had some years ago. Okay, sometimes we could have Asherman syndrome. Okay, and if that is not corrected, it might be difficult for such a person to get pregnant. But what I will advise you to do is try and go to any teaching hospital around you so that the management can be taken to a higher level. Thank you very much for that question. Okay, so talking about the efforts that we have made so far in our effort to tackle this perennial scourge or endemic disease, okay, that has continued to ravage Nigeria all year round. In that conference that was held in Abuja just about a year ago, they've been able to form National Research Lassa Fever Consortium. Okay, it was inaugurated, okay, headed by NCDC, Nigeria Center for Disease Control, or National Center for Disease Control in Nigeria. Now, this consortium actually has these 3 hospitals that we mentioned as members, talking about Irua Teaching Hospital, FMC Owo, as well as Alessa Kweme Teaching Hospital in Abakaliki. Okay, so this will enable them to do more research on a number of areas. It could be vaccination, it could be case management, and what have you. Okay, so also, one of the things that they did, I want to read out from what I have here, going by the account that the head, the Director General, Doctor, is a infectious epidemiologist, Dr. Chikwe Ihekwazu. Okay, so he said that since the conference, we have been working very hard to strengthen our capacity for Lassa fever control. Significantly, our surveillance data collection, analysis, and management for Lassa fever has improved. Chidera from FCT. Chidera, good morning.
Good morning, doctor. My name is Chidera. I'm calling you from Abuja.
Thank you very much, sir.
Okay. You said the person that is, like, if you give a malaria test and you still have the symptoms of malaria, so there is a possibility for you that you have Lassa fever.
Yes, sir.
Okay, so what are you going to do immediately when you find out that there is such thing? Do you need to start going to the teaching hospital in Benin or?
Thank you very much, my brother. Now, what you need to do once you've been treated, okay, that also brings us to the topic of self-medication. Oftentimes in this part of the world, when we come down with a number of symptoms like that, before we get to the hospital, we must have started a number of medications ourselves. When we are not getting better is actually when we go to the hospital. Now, when you get to the hospital presenting with a febrile illness, and some lab tests have been done for you, and they've been able to rule out malaria, typhoid fever, and some other infections, and the fever is still persisting, it's a reason for one to have a high index of suspicion, both the patient and the management team, okay? Because of the fact that Lassa fever is endemic in this region, it should also be considered. Now, currently, I think it's I'm not so sure about that, but I think it's a notifiable disease. Now, once it's picked out, you need to quickly isolate such a patient. Immediate isolation is important so that the person doesn't spread it to some other people around the person. Okay, when we talk about transmission, we'll see a number of ways through which this can be can actually done. Now, it is the duty of the hospital to get in touch with the relevant government agencies, okay, so that samples can be sent. The patient may not have to be moved physically to those centers we mentioned. What is needed is for the blood samples or whatever samples that are taken to be sent for those centers, those reference laboratories that have the capacity to carry out this diagnosis, because it is not just any lab in the country that can do the laboratories. They are not equipped to do that. That is why the diagnosis is a difficult one. Thank you very much for that question.
Okay,
so,
please, I still have another question.
Go ahead, sir.
Okay, the labs, where can they be found?
The 3 major centers with 3 reference laboratories. One is in Irua Teaching Hospital, Edo State, Federal Teaching Hospital. The second one is in Alessa Kweme Teaching Hospital, Abakaliki in the southeast, and the third one is the newest of them all is in Federal Medical Center Owo, which was established in the last 1 year, according to the Director General. Yes, yes, according to the Director General of
But
NCDC.
like the doctor rightly puts it, you can consult your normal GP and they will get your samples down to those places. That's if you cannot go there yourself.
Oh, those are bad.
Famous.
From Lokoja.
Good morning, Famous.
Good morning.
Yeah, good morning.
The doctor is here.
Can you turn down your TV volume? And
are you there? Okay, oh, so sorry. Okay, so we have developed a harmonized database which did not previously exist using the Surveillance Outbreak Response Management Analysis System, SORMS, SOMAS 2. Okay, we are committed to working in partnership with other agencies and organizations to ensure that the response to Lassa fever is informed by the best available research evidence and data. That was Dr. Ihekwazu, the Director General of NCDC, okay, talking about the efforts, talking about the progress that have so far been made following that Lassa Fever International Conference that held in Abuja about a year ago, with the team rising to the challenge. So Nigeria is making efforts to truly rise to the challenge. Suffice also to mention that some of the countries, we are doing a number of collaborations with some of the countries that are equally troubled by this scourge, talking about our neighboring countries. I think in that account, you also talked about Nigeria sending health personnel to help out in some of the other countries. Okay, so we are taking the lead, but we need to do more as a country. That is all we are saying. Now, talking about transmission, we have said before that the transmission is usually from rodents. Abdul from Nasarawa. Abdul, good morning.
Good morning, how are you?
I'm
We are fine, sir.
Yes, this issue has been long for quite some time. But for the sickness, the government took care more than expected than Lassa fever. Is there no any kind of immunization against this dreaded disease?
Thank you very much, sir. Do you have any more questions, sir?
No.
Okay, thank you very much, sir. At the moment, there is no vaccination for Lassa fever, but researches are ongoing, both in Nigeria and beyond. The essence of having that conference was to increase the discussion, to have further involvement with international partners to see how quickly a vaccine for this scourge can be developed. At the moment, none exists, okay? And suffice also said that the disease is curable if picked early enough. Thank you very much, sir, for that very important question. Okay, so talking about the transmission, usually from rodents to humans. Now, what it happens when rodents come in contact with our food materials? It could be our grains that we have put out to sun dry. It could be food materials that were not properly covered with airtight lids, okay? Once they have access into it and pass their urine and defecate on top of them and their droppings, anybody that eats such contaminated food may come down with infection, okay? It can also be through inhalation, okay, of the droppings or the excreta of these animals. That can also happen, okay? So the truth of the matter is that there's a Lassa fever belt, and the whole of Nigeria is covered by this Lassa fever belt and beyond to some other West African countries. We have this set of rats in all of these belts because they're usually the primary reservoir. Now, when an individual is infected, such an individual in a community can infect other people, okay? Yes. In hospital environment too, health workers have picked up the infection in time past. That is also possible. Now, pregnant women are said to be, we have Eno from Edo State.
Eno, good morning.
Good morning.
Yeah, the doc is here.
Yes, I'm watching your program, and
You know, the federal government said they will put one PHC, primary health center, in every ward. We need to coordinate these things properly with the structures we already have. For instance, we need the counselors to work with us, so these people with Lassa fever can be identified easily where they are, especially in the rural areas. And then the counselor will pass the information to the next, the higher structure, which is the local government chairman, and then taken to the general hospital. We cannot have a situation where we do guesswork. It's a very dangerous disease we are dealing with. And so please, can we let the government know that we need to hurry up about the PHC in each ward in Nigeria, and then we'll get more results. Thank you so much, Dr.
Thank you very much.
Yeah.
Thank you very much. I want to read out something just close to what he has just suggested. A very beautiful suggestion from you, sir. Thank you very much. In 2019, following NCDC's support in establishing State Public Health Emergency Operations Centers, EOCs, we saw an improved level of coordination and response activities across states. Okay, there are actually EOC centers, okay, in most of the states, if not all of the states that the government have been able to establish, that are usually saddled with coordinating responses when there are outbreaks in terms of treatment, notification, and what have you. Thank you very much for pointing it out. Okay, so talking about the diagnosis now of Lassa fever, how are the diagnoses made? We have said before that it is a difficult diagnosis to make. That is the most challenging thing about it. It's not a diagnosis that can be made in a side lab in any hospital or any diagnosis center around us in any part of. So those samples must be. That's why we keep hearing suspected cases, confirmed cases. Okay, so you need to have high index of suspicion so that if you have a suspected case, you may have to do what you need to do to send the samples to places where they can be, where the diagnosis can be made. Some of the methods that are used to make the diagnosis are what we refer to as ELISA, enzyme-linked immunosorbent assay. Okay, that sounds a bit medical. Okay, also reverse transcription polymerase chain assay can equally be used. Okay, and a number of some other also the virus itself can also be cultured, but this can happen in those centers that we're talking about. The culture could take about 8 to 10 days. Okay, the viral culture can be done, okay, in making this diagnosis. So people who are medically oriented will know that this test investigations that we're mentioning now are not things that you can commonly do in just any lab. It must be in a reference laboratory.
I do wider test. Yeah.
Now, talking about the treatment, how are these conditions treated? If it's caught early enough, that's a viral agent, ribavirin, that has been seen to be useful in treating these individuals. But majority of the care that such individual will need will come from supportive therapy or supportive care. Okay, in the sense that if the person has electrolyte imbalance, you need to do what you need to do as a healthcare personnel to correct that. If person is dehydrated, you need to give infusions. If the person is febrile, you need to give analgesic to knock off the to bring down the fever. And then do some other things. The person have some other additional infections, secondary bacterial infections, you also need to treat as may be necessary. Okay.
Well,
now,
Dr.
prevention.
Before we quickly go to prevention, we've not really heard from WHO about this as well, WHO. Is it because this is not a global scourge, or we've not really heard their name in all the things you've been reading since?
No, WHO has been actively involved with the Nigerian government, ministries of health, and other agencies that are concerned. As a matter of fact, there are a number of collaborations that are currently ongoing. Okay, that are currently ongoing. For instance, the NCDC in Nigeria has an ongoing collaboration with the Ministry of Environment, with the Ministry of Agriculture. Okay, so they're getting them involved in the rapid response teams because this has to do with the environment,
And
bush
the
burning, agriculture, and then what have you. Okay, so that some of these practices we can find a way of curtailing against them or working against them so that they don't end up chasing these rodents into our living homes. Okay, but we must go to prevention because that is important. What is required is keeping and maintaining a good clinic, a good community hygiene and personal hygiene in our environment. Sanitation is key. Sanitation is key. Ensuring that our food materials are properly covered in our houses. Ensuring that while caring for a sick relative, you're very well covered. Wear gloves if you have to. Don't come in contact with fluids, bodily fluids that are coming out from them. Safe and dignified burial practices is equally important. It's on that note that we'll be ending the presentation today.
Goodbye,
Thank you very
everyone.
much for your time.
Thank